Okay, picture this. You wake up, nagging cough, sore throat, uh, or maybe, you twisted your ankle playing sports over the weekend.
Oh, yeah, that happens all the time.
Right. And it's clearly not a trip to the ER kind of emergency, but your regular doctor can't see you for days. You definitely don't want to sit in an emergency room either. So, what do you do?
It's that moment, isn't it? That, okay, I need someone to look at this, but where? You know it's not 9/11, but waiting feels wrong too.
Exactly. And that's precisely what we're digging into today, urgent care clinics. These places, they've really become such a vital part of the whole healthcare picture.
Ugh.
We're looking at insights from a pretty detailed document explaining their services, and our mission really is to just demystify urgent care for you. Like, when should you go? Why is it the best choice sometimes? And what can they actually do there? It might surprise you.
Yeah, there's quite a range.
Think of this as, I guess, your shortcut to understanding this really valuable resource a bit better.
It's about finding um, that sweet spot for care,
Yeah. Yeah.
bridging that gap between your GP's office and a full-on emergency room visit,
Right. Yeah.
making sure you get help pretty quickly for things that aren't, life-threatening.
Okay, let's unpack that right away. The core idea. Urgent care clinics, fundamentally, they're designed to be that bridge. Primary care on one side, ER on the other.
Exactly.
It's about getting seen fast when your doctor's office is shut or just totally booked up. But, and this is key, you definitely, absolutely do not need the emergency room.
And what's really interesting, I think, is how they meet such a practical need. It's immediate care, but not emergency care.
Yeah.
They really offer a solid answer for those, uh-oh, what do I do now?
Hmm.
Moments that just pop up, right?
Hmm.
It's about access when timing matters, but maybe not in a life or death way.
Okay, so keeping that core purpose in mind, what kind of stuff can they actually do at an urgent care clinic? Let's start with the obvious. Immediate care for minor illnesses, minor
That's
injuries.
the common stuff.
Yeah, they handle a really wide range of things that aren't emergencies. You're probably thinking, coughs, colds, sore throats, maybe the flu, RSV, even COVID symptoms.
Absolutely, all those respiratory things. But it's broader than that, too. Think earaches, sinus infections, minor cuts, scrapes, maybe small burns.
Okay.
And importantly, for those sudden brain strains,
Yeah.
maybe even what you suspect is a minor fracture. Urgent care is often a really good first stop.
Ah, okay. Good to know.
Yeah, and also things like rashes, maybe a mild allergic reaction, nothing severe, or, nausea, vomiting, perhaps mild dehydration.
And why this matters to you, listening, is pretty simple. You don't have to wait days for your regular doctor.
Mm.
These places usually have extended hours, often open weekends, and they take walk-ins. That's a huge plus when you feel rubbish now.
That convenience factor is massive. It's really why they've become so popular. It's healthcare fitting around your schedule a bit more, not the other way around.
Yeah, totally. Now, something that genuinely stood out to me from the source material was the diagnostics piece, the testing they can do right there.
Oh, yeah, the on-site stuff.
Right. Imagine getting an x-ray or like a rapid flu test done right then and there, instead of being sent off somewhere else and waiting.
That on-site capability is a huge time saver. It
Mm.
makes things so much more efficient. They commonly do rapid tests for flu, strep, COVID,
Okay.
urinalysis, pregnancy tests too,
Mhm.
sometimes blood work like a CBC that's a complete blood count, or glucose checks, even EKGs sometimes, checking heart rhythm.
Wow, EKGs too.
Yeah, some do. And of course, x-rays. Really useful for checking for fractures or maybe pneumonia. It just streamlines the whole process. Diagnosis and treatment plan, often in one visit.
And speaking of treatment, beyond just figuring out what's wrong, what kind of immediate help can they actually give you?
Well, they can often provide relief right on the spot. So
Yeah.
they might prescribe antibiotics if it's a bacterial thing, or antivirals, maybe some pain relief.
Mm.
They can handle wound care, you know, cleaning and stitches for minor cuts. If you're a bit dehydrated, maybe IV fluids. And breathing treatments like nebulizers for things like asthma or bronchitis flare-ups.
Okay, that's quite a bit.
It is. And here's something maybe less obvious. A lot of urgent care clinics also do occupational health stuff, physicals and things.
Ah, right. That broadens the scope beyond just being sick, doesn't it?
Definitely.
Like you might find pre-employment physicals there, or those DOT physicals for commercial drivers.
Yep, the Department of Transportation one.
Do drug and alcohol testing too sometimes, and even return to work or return to school notes.
Exactly.
Now, here's a little pro tip we found. While walk-ins are great for illness or injury, for these kinds of specific services physicals, DOT stuff, it's probably smart to call ahead.
Yeah, definitely call first. Just check if they offer it, if you need an appointment, or if there are specific hours for those services. Saves you a trip.
Good advice.
And if we connect this to the sort of the bigger health picture, many clinics also offer routine vaccinations, flu shots, tetanus boosters.
Oh, okay.
Some locations might even do travel vaccines, though that's less common. Or basic wellness exams sometimes. It just shows how versatile they are. It's not just for when you're suddenly ill. They could support ongoing health needs, too.
Makes them a pretty accessible resource for, well, everyday health stuff.
Exactly. Very versatile.
Okay, now, we've talked about how valuable urgent care is, how much they can do, but there's a really, really critical distinction we absolutely have to make crystal clear.
This is crucial.
Urgent care is not, I repeat, not a substitute for the emergency room. This is maybe the most important takeaway for you listening.
Couldn't agree more. Patient safety really hinges on understanding this difference.
Mm.
What signs, for you, absolutely scream ER, no question?
That's such an important question because, yeah, knowing this could literally save a life. We're talking serious, potentially life-threatening situations.
Right.
Think chest pain or pressure. Any stroke symptoms like sudden numbness, weakness, especially on one side, slurred speech, confusion, severe bleeding that won't stop, or a major head trauma,
Okay.
difficulty breathing, like really struggling for air, or, losing consciousness, passing out.
Yeah.
Those are 9/11 or straight to the ER situations. No hesitation. Urgent care is for the non-life-threatening stuff. These are true emergencies.
Absolutely. It really boils down to severity.
Yeah.
You have to assess how serious it feels and choose the right place.
Right.
Don't risk it if it seems major.
Couldn't have said it better. So, with that crucial warning in mind, let's get practical again. When should you head to urgent care?
Okay.
The general rule seems to be, you need medical attention today, like same day, your regular doctor's office, it's closed, or they can't fit you in. And your condition, while uncomfortable or worrying, isn't life-threatening, but you just can't wait.
That sums it up pretty well. And thinking about that, it really brings up the question, how much time and honestly, how much money can you actually save by making the right call here?
Oh, that's a big one.
It really is. Did you realize that going to urgent care for, say, a minor sprain or a bad cough could cost hundreds, potentially thousands less than the same thing treated in an ER?
Wow, that's a huge difference.
It's significant. Plus, think about the other benefits. They're usually open 7 days a week, right? Evenings, weekends.
Yeah, after hours.
They can treat both adults and kids. And like you said, you can often just walk in or maybe call ahead to check the wait time. That's real convenience and efficiency.
That financial piece is massive, though. It really changes how you might approach needing care quickly, doesn't it?
It absolutely should. It can take what feels like a stressful medical event and
Yeah.
make it much more manageable, more accessible, and definitely more affordable.
Okay, so let's just quickly recap then. Urgent care clinics. They're incredibly valuable, they're accessible, often way more affordable for a whole bunch of common illnesses and injuries. They really do fill that critical gap in healthcare today, connecting you to prompt care when your primary doc isn't an option and the ER isn't the right place.
And knowing the difference, understanding what they offer versus what an ER is for, that really empowers you. It helps you make smarter, more confident choices about your health, where to go, and it can save you time, money, and a whole lot of stress.
Right. It puts a bit more control back in your hands. So here's something to think about as we wrap up. We see healthcare access changing, lots of digital tools popping up too. How might having this clarity around urgent care and knowing what it is, when to use it, empower you even more? Could it help you be more proactive, more efficient in managing your family's everyday health needs? Maybe even change what you expect from healthcare convenience overall?